And so building on that, speaking of different stakeholders you talk about building new relationships, collaborative relationships with your providers.
Right.
Maybe you could talk about that and give me an example of how you're doing that and building trust with those kind of providers.
Well, I think the economy is so matrixed and so complex. It's global. Our governments like to think they control their economies, but I think our governance models have been outgrown by our economies. And so we have these businesses that are connected in so many different ways to so many different places and so many different stakeholders. We have to figure out how to manage that. And being singularly focused on the customer, defining who the customer is the first priority, because we know our customer are the people that use our services. But then how do we engage all the other stakeholders to support us in that mission? And in order to do that, you have to make connections and share data that in the past, particularly in our industry, we would have considered to be proprietary.
Yeah.
And stuff that we own. We need to let go of that control in order to gain power over a social ecosystem that's aimed on the customer and bringing together all the skills necessary to provide the kind of quality of service they need.
Can you give me an illustration of how you've let go of data to actually improve that customer experience?
Back in the 90s, we had this system called capitation, where we used to write a check every month to providers for each patient or member that we had. Their patients are members. And that would be it. We'd send them a check with the patient's name and their social security number and their member ID number and the check amount. And it was on a green bar report. And I used to deliver these. I was at that level of my career. And it had big rubber band around each side. And the check was in an envelope underneath it. And we said, good luck with that. Well, the hospitals and the physicians didn't know about what is called incurred but not reported, that there are services going on in the system somewhere that are not yet reflected in the claims. And so as a result, they all started to go bankrupt. And so in the late 90s, capitation systems blew up across the country and systems went bankrupt. And so this time around, we actually have to give them all the data. We had the data back then, we just didn't share it with them.
Right.
And so now we have to give them the data. We have to give them a 360-degree view of the person they're taking care of. And we have to be willing to let that go, even though it may be an admission against self-interest on our part about what's going on inside the system.
Right.
That creates a transparency in the dialogue and the negotiation that comes to fairer relationships, which I think are more sustainable and trusting relationships to create longer-term business models.
So is there an example where you actually gave this data and it resulted in like a better patient outcome that you could give us in something like that?
So in a couple of places, early on in 2006, we have a tool even today called Active Health. And this tool looks for omissions and commissions in care.
Okay.
So, things that haven't been done that should be done, or things that are being done that shouldn't be done.
Right.
And one of our first instances was a patient who received a prescription for metformin, which is an oral diabetic drug. Metformin is contraindicated in cases of renal insufficiency or renal disease. And this endocrinologist only had one view of the patient, which was they were in their office for their diabetes.
Yeah.
Well, we actually had data that showed that they were seeing a nephrologist and that their serum creatinine, the indication of their kidney health, was getting worse. And we saw the prescription come through. And we sent a note to the doctor, both doctors saying, you guys need to talk because this patient shouldn't be on metformin. You're going to destroy their kidneys, and they're already compromised to begin with. And we saved that patient's kidneys.
Wow.
And who knows what that would have been for the rest of their life. So that's a small instance.
Yeah.
In bigger instances, we now have partnerships with systems like Innova in Northern Virginia, 60% of the market, where we've agreed to share data, create a joint venture company. We've given them our intellectual property and our membership in that region. They've given us capital. And we now work together on a product that over the last 3 years has been the fastest growing product in the marketplace and is 15 to 20% lower than the Blue Cross Blue Shield product in the marketplace with better quality and is profitable, generating the margin to continue to invest in the business. But it took us being willing to give up then intellectual property of how to manage risk, give up the technology to support their claims administration, give up our membership in exchange for them contributing capital to a new way of working together with providers.
And so you were able to drive the cost down to get below the other
Competitors in the market.
competitors in that marketplace. That's significantly,
Yeah.
10 to 15%,
15 to 20.
15 to 20%. Wow,
Yeah.
very interesting.
Yeah.